Reducing infant mortality. Hi, I'm Ken Missing. Today I'll be discussing the issue of infant mortality, which is when a baby dies before their first birthday. I'll explain who it affects, why it matters, and what can be done to prevent it. I also show you a fact sheet and social media graphics I created to raise awareness. What is infant mortality? Infant mortality is a serious public health issue and a sign of how well a society supports families and healthcare access. In the US, around 20,000 babies die each year. Most deaths are linked to premature birth, birth defects, sudden infant death syndrome, and maternal complications. The US rates are higher than any other developed country. Why infant mortality matters. The US infant mortality rate is significantly higher than in countries like Japan or Sweden. This signals deep-rooted issues like healthcare inequality and gaps in education and support. Infant deaths leave long-term impacts on families and communities. That's why reducing infant mortality is a top priority in Healthy People 2030. Who is most affected? Black and Native American babies are the most affected. According to CDC, Black babies are more than twice as likely to die before age 1. These disparities are tied to limited access to healthcare, poverty, discrimination in care, and chronic stress. Southern states have the most outcomes. Challenges for at-risk communities. Many families in high-risk groups face challenges like long distance to clinics, poor nutrition, and no insurance. Lack of safe sleep knowledge also increases infant death risk. All of these issues combine to make pregnancy and infancy much more dangerous for some communities. Proven solutions in education. The good news is that these deaths are preventable. Expanding parental and postnatal care, especially in rural or underserved areas, is a big step. Education also helps. Programs like Georgia's Community Outreach Project have lowered preterm birth rates by helping moms learn about healthy pregnancies. This is a copy of my fact sheet. My fact sheet highlights several key facts about infant mortality. First, around 20,000 babies die each year in the US, which is more than any other wealthy country. Black infants are more than twice as likely to die as white infants. This shows the racial health disparities we need to fix. The most common causes of death include low birth weight, sudden infant death syndrome, and birth defects. Social risk factors like poverty, lack of prenatal care, and unsafe sleep environments also play a big role. I created 4 social media graphics, well, 3. Each one shares a different message. The first one, statistics, risk factors, uh, prevention tips, and a call to action. The goal is to educate and engage people online using clear visuals and hashtags like Safe Sleep and Healthy Babies. Uh, this graphic says black infants are 2 times more likely to die before their first birthday than white infants. These are some of the risk factors I talked about earlier. And these are simple steps that can save lives, like attend regular checkups, avoid smoking and alcohol, eat nutritious food, and practice safe sleep for babies. Trusted online resources. The CDC, the NICHD, the ODPHP, and the World Health Organization. These resources help inform my fact sheet and social media posts. The CDC and NICHD offer trusted data and explain what puts baby at risk. The ODPHP shares real success stories like Georgia's program. The World Health Organization gives global context on how countries fight infant deaths. Conclusion and call to action. To wrap up, infant mortality is a public health crisis, but it is not hopeless. We can change the numbers by focusing on better access, more education, and stronger support systems. Everyone, health workers, families, and policymakers, has a role to play. Let's act now to protect our most vulnerable. Thank you.